All right, thanks everybody for coming. I'm really excited to be here. I was invited to speak, as you can see, about being culturally competent when caring for the Muslim patient, and I thought this was always a really important topic, but especially in Seattle and especially in our current times when we have a pretty large population of refugees now incoming from places like Syria, and even prior to that, as you know, we have a pretty large refugee population from Somalia and other countries, and so I think in your practice, if you decide to stay in the area, but even just during training, you'll certainly come across many Muslim patients, and I just wanted to sort of go over a lot of the issues that you might come across and may hopefully provide some tips and some basic education that might help you feel a little bit more comfortable and help your patients also feel more comfortable with your care. All right, so I just wanted to start with a really brief introduction about Islam to talk about just some basics for background. This is in no way supposed to be a religious talk at all, but I just thought it would be useful to have some background when you're kind of working with Muslim patients. So some basics. Islam is an Arabic word, and it comes from a word that has two meanings. The main one is submission. So Islam is like the root word of Islam and submission, and so it implies something to the will of God or to what God wants you to do. And then the other word that's implied by the word Islam is salam, which means peace. And so it sort of suggests also that Islam is a religion that really promotes peace and tolerance, and that's one of its core values. And then just some semantics that I wanted to clarify, because I think a lot of people have confusion with this, is that Islam is the name of the religion, and Muslim is what you call a believer of the religion. So kind of like what a Christian is to Christianity, a Muslim is to Islam. And then Allah is a word that's sometimes mistranslated, but simply it's just the Arabic word for God. So it doesn't refer to like a different God. Muslims believe that there's only one God that's shared by all religions, and Allah is just the Arabic word for it. So it doesn't have any other connotations past that. And then the basic belief of Islam is pretty simple. Islam teaches that in order to be a Muslim, you have to believe that there's only one God, and that Muhammad, peace be upon him, is the last messenger of God. And that's really the core, that's really the only requirement to be a Muslim. And then the holy book of Islam, many of you guys might have heard of it, it's called the ORALM. It was revealed, we believe, to the Prophet Muhammad, may peace be upon him, between the years of 610 and 632. So over 1,400 years ago. And then also Islam is sort of taught as a way of life. So it's not just a religion. Islam teaches that it shouldn't be just a religion that people come to like once a week or once a month or once a year. Instead, it really, if you ever study Islam, you'll find that it really teaches everything about a person's life, including like what should be done when a person is born to what should happen when they die, and everything in between. So it talks about social interactions. It talks about how one should clean oneself, or even like recommendations about how to go to the bathroom, how one should marry, or how one should make friends, and how one should take care of one's health. And so it's often described as like a whole entire way of life, not just something less than that. And then also Islam teaches that the life is kind of like always a test and a trial. So anything that afflicts a person in this life is a trial from God, and God is sort of watching to see how you'll react to that trial. And I'll kind of refer to this point a little bit later on in the talk as well. So a little bit more background. Muslims constitute a pretty large population of the world and in the US. There's approximately 1.7 billion Muslims worldwide, and it's actually reported to be the fastest growing religion both in the world and also in the US. So I think this is, again, another reason that we should all sort of be familiar with it. There's some different estimates about how many Muslims are currently living in the US, but it's about 7 million Muslims right now. And just wanted to clarify also some things that people might not know, or some common misconceptions. A lot of people assume that kind of like all Muslims are Arab and all Arabs must be Muslim, but that's really not true. In fact, only 20% of the Muslim population in the world are Arabs, and the rest are usually from other countries. And in the US, about 12% of the Muslim population in the US is of Arab descent, and so the majority is actually from different regions of the world. And then 50% of American Muslims are actually converts from African American converts. And then the world's largest population of Muslims is actually located in Indonesia. So again, far from the Arab world. And I found this map online that I thought was kind of interesting to show where the majority of the Muslim population is distributed. And as you can see, it's a lot in North Africa and Asia. And then also just wanted to kind of provide a brief intro about Islam and the role of medicine in Islam. So I think unfortunately, because of many events in recent history and maybe some of the ways that Islam has been portrayed in the media, there's a notion that Islam somehow might promote injustice or violence, but actually that's nowhere near what the teachings of Islam are. There's actually a pretty well-known verse in the Quran that says that whoever kills a person unjustly, it's as though they've killed all of mankind, and similarly, if someone saves a life, then it's as if they saved all of mankind. So Islam has really always placed a pretty large emphasis on humanity and on taking care of other people and on taking care of yourself. And so just briefly going into the history, Islam actually has a pretty large presence in medicine in the past, and so there's many Muslim physicians and scientists that did a lot of great work in the 10th century, and some of their teachings are still kind of used today. So one of the famous physicians was named Ibn Sina, and he was sort of known as the father of modern medicine from the 10th century, and many of his textbooks were used in early modern Europe as well for several centuries after that. Another person that you might hear about is Al-Zawahiri, who was a famous surgeon, and he devised many surgical instruments that are actually often still used in some form today as well. So Islam, as a culture, has left a pretty big impact on the field of medicine as well. There's reports that inoculation or vaccinations were actually first performed in Turkey and then brought to Europe in the 1700s. So they had a pretty large contribution there as well. And in general, as I mentioned, Islam really encourages one to take care of one's life and to maintain healthy lifestyles, and there's a lot of teachings about sort of what things that you should eat or not eat in order to maintain your health. And then I wanted to talk about briefly just the 5 pillars of Islam, and I'll relate these to how they connect to healthcare and to your Muslim patient potentially. So really briefly, the 5 pillars of Islam are sort of like the main core tenets that Muslim is supposed to practice. So the first one is the declaration of faith that I mentioned earlier, which is that they should declare that there's one God and that Muhammad, peace be upon him, is the messenger of God. The second pillar is prayer, and so Muslims are taught that they should pray 5 times a day. And the times of the prayer are actually based on the position of the sun in the sky. So it sort of varies from season to season, and so the timings vary from season to season, but they're based on, the first one is before the sun rises, the second one is kind of midday, probably about now, and then the third one is mid-afternoon, the fourth one is after sunset, and the fifth one is at night. So I'll talk about this more, I think, in my next slide, but it definitely will sometimes impact a lot of patients in the hospital and in other settings. The third one is fasting. So this primarily refers to fasting during the month of Ramadan, which you guys might have heard about. It's one of the months of the Islamic calendar, and during that month Muslims are required to fast every day from dawn until dusk. So this obviously also has implications for people that are ill or people that might have to take medications or have other health issues, and I'll go into that in a little bit more detail later on as well. The fourth one is the pillar of charity. So all Muslims are required to give a percentage of their wealth every year to charity. And then the fifth one also is something you might have heard about in the media, actually just occurred this year. It's the pilgrimage to Mecca, and it's called the Hajj in Arabic. And every year that happens, it's based on a lunar calendar, so the timings again vary according to our calendar, but this year it actually just occurred in early September, so a few weeks ago. You might have seen pictures or heard about it on the news. All right, so starting with the second pillar of prayer. Like I mentioned, these are the 5 timings of the prayer every day, and traditionally Muslims are supposed to kind of wash up their hands and face before the prayer in order to, it's like a symbolic ritual to sort of purify themselves before they pray, and then the prayer also involves certain motions that involve sitting and kneeling and prostrating. And so here's a kind of an example of a woman that's praying, and I think This is certainly relevant because especially if you work in a hospital, you might come across patients that are looking for a place or time to pray, and it's helpful if you're kind of aware of what the basic needs are, and if you can sort of help them. It's pretty, it's actually not too rigorous in terms of requirements, and I think also the important theme that I'll sort of be saying over and over again is that Islam is very accommodating towards people's personal needs, and so in the setting of illness, for example, prayer and other pillars can easily be accommodated to fit what their needs are. So, for example, if a patient has some kind of restriction against like using water on certain parts of their body, then they can accommodate and not use water to wash themselves. Similarly, if they're disabled and they can't do the traditional motions of prayer, they can modify it to what they are able to perform. Even if someone's not able to get out of bed, there's accommodations to where a person can do the prayer sitting in bed or even lying in bed if they have to. So it's very flexible according to a patient's needs, but it is something that is important to a lot of people even when they're in the hospital, and also to patients' families and loved ones that might be in the hospital with them. So typically, the Muslims will pray 5 times a day, and they'll face Makkah while they pray, and so depending on where you are in the globe, it'll be a different direction, but usually for people in Seattle, they'll face northeast because that's the shortest distance to Mecca. And then, like this woman is doing, you can just lay down a small mat on the floor next wherever you are and pray. There's no specific requirement that it has to be in a specific place. It can really be anywhere, as long as you're kind of facing in the right direction. Okay, and then the other pillar that is, I think, very relevant to healthcare providers is fasting. So, like I mentioned, this is usually most often practiced during the month of Ramadan, which is the 9th month of the Islamic calendar, and Muslims are required to fast every day from dawn until sunset. And again, because the Islamic calendar is based on a lunar year, it's slightly shorter than our Gregorian calendar, which means that the months also vary by season. So every year, like Ramadan every year moves up 10 days every year. And for the past few years, it's actually been in the summertime, which means that the days are very long and it's very challenging fast for a lot of people. But Muslims are required to abstain from any kind of food or drink, including water, for this time period if their health permits. So again, if people are sick, they can obviously make accommodations to it. If you're sick, you're not required to fast at all. You can just sort of maintain your normal diet. If you're on medications that need to be dosed frequently throughout the day, you're also exempt from fasting. If you have any other medical illness that would make fasting impair your health, then you're exempt from it. But it's a really special time of year, and a lot of Muslims really try their best to accommodate whatever health needs they have in order to allow them to fast. So I think if healthcare providers like us can be aware of this and try to make accommodations as much as is practical, then patients would really appreciate that. But also keep in mind that they can definitely be exempt if they have important medical needs. And that's all I wanted to say about that. All right, and then the other pillar I wanted to talk about, just because I thought it would be relevant, is the pilgrimage to Mecca, which is called the Hajj pilgrimage. And this is supposed to be a requirement upon every Muslim as long as they're kind of physically and financially able to make the journey. It occurs once a year. The dates are pretty are the same every year, so you can only do it at that certain time of the year. Every year, the crowds keep growing and growing, and so estimated between 4 to 5 million people travel to Saudi Arabia every year to perform this pilgrimage. So, as you can imagine, it's a huge crowd, and there's a lot of health implications that come from being in a really huge crowd like that in really pretty small area. So prior to the travel, people will often have to see their doctors to get certain immunizations. Like I think the Saudi government requires meningitis immunizations for everybody that goes, and then they might sort of require other kind of preventative medications or just health advice to prevent any contagious illnesses that are pretty common while they're there. I thought there's actually like a lot of health information that's provided by the Saudi government, which is kind of neat. There's even like a health app that's provided by the government that provides like different tips of things to keep track of before you go and while you're there. And I have a link to that at the end of my presentation. So those are sort of things that you guys might want to keep in your back pocket in case you have patients that are asking about advice before they go on their trip. All right, and then next I just want to talk about some of the kind of cultural and religious traditions and values that are important to a lot of Muslim patients. I should sort of preface this by saying that Islam, like any other religion, has a really diverse following, and so I sort of am talking about the core teachings of Islam and the traditional teachings, but certainly in your life and in your health care practices, you'll come across a wide variety of people that have different adherence to these teachings, and so it's important to just keep an open mind and kind of be able to accommodate to whatever your patient's unique needs are. But these are sort of more common issues that I think you'll see most often with patients that that are Muslim. This was kind of an interesting image, just shows sort of like the different cultural ways that a lot of Muslim women dress, and a lot of it sort of depends on their cultural backgrounds from whatever country they are. But modesty is certainly an important teaching in Islam, and so something that will be relevant to healthcare providers as well. So Islam teaches that both men and women should dress modestly in a way that sort of keeps their body covered and not, I guess, provocative or too distracting to other people when they're out in public. So with that comes some implications. So, for example, for women are required to cover their hair and most of their skin on their body just for the purpose of modesty. And so in the hospital, it can be a challenge sometimes because they'll have to change into hospital gowns. But even so, a lot of Muslim women will really prefer to be able to keep as much of their body as covered as possible just for comfort. And so it's nice if we can sort of accommodate that to the best of our abilities and at least be kind of cognizant of that preference. Similarly, a lot of Muslims do not really like to have a lot of physical touch with the opposite gender, and so they'll sort of be uncomfortable with shaking hands or hugging with members of the opposite gender, and so that's something also to be aware of. Certainly, I'm not saying that all Muslims adhere to these practices, but I think it's important to sort of keep an open mind and maybe wait to see how your Muslim patient reacts to you before you're shaking their hand or hugging them and making them uncomfortable. So when you're in the hospital, I guess some kind of like common sense tips, obviously, that probably apply to a lot of different patients, not just Muslims, but certainly it's nice to be able to knock on the door and announce your arrival before you're barging in case they're not properly covered in a way that they feel comfortable. A lot of people will really prefer same-gender providers as much as possible. Sometimes in the hospital it's not really feasible to accomplish that, but certainly in other settings it is, and that's often preferred. And then again, with the modest dress, it's just nice to be aware of that, especially in certain settings, with patients in an OB ward. It's nice to be able to sort of keep them in as private a setting as possible so that they're not too exposed to too many other people. And then also during radiation and surgery, if you guys can sort of, if I guess all of us can be try to be aware of that and keep our patients as modestly covered as they would like to be. All right, and then also just some kind of cultural, social preferences that I thought would be that we should all sort of keep in mind is that a lot of people from, I think, Muslim countries, especially, I think these might be relevant to a lot of immigrant populations that we have here in Seattle, and maybe not just Muslim immigrants, but immigrants from other parts of the world as well. But oftentimes there's a lot more reliance on family and friends, especially for support and for decision making, compared to a lot of Western patients that might be a little bit more independent in their medical care. And so it's really, I think, often appreciated to sort of involve the whole family or group of friends or whoever the patient wants to bring into their medical care. Obviously, language can often be a challenge. A lot of patients might be immigrants from other countries and might not speak English as a first language, or might not even be very comfortable speaking English, period. In those settings, I know that as a medical student myself, I was always taught that we should always try to get a professional interpreter to play the role of translating. One, because they're sort of more nuanced in the medical terminology and they can be better able to provide a more accurate translation. But I found in my kind of personal experience that oftentimes a lot of, especially immigrant populations, don't feel as comfortable with professional interpreters that they don't know personally, and so they'll actually request that we allow their families to interpret instead. And I know that this might sort of go against our traditional teachings of what an interpreter should be, but it really makes a big difference to the families to sort of keep that confidentiality and for them to be getting a message from someone that they feel they know personally and trust, rather than a stranger who's an interpreter that they don't know at all. So I think, I think it's reasonable to make those accommodations and use family as interpreters in some settings, just to make the patient more comfortable. Also, I think a lot of people that might be immigrating from different countries have a really different health literacy than people that grew up in the West might have, and so again, that's just important to have in mind, and to be able to have the patience and the time to sit down and explain things to them that you might, with other patients, assume that they already know. You shouldn't assume too much with anyone, but keep in mind that especially immigrants from other countries, that people that might have come from from less privileged backgrounds might not have the same education that we got growing up in America, and so they might require a little bit more explanation or a little bit more time in their conversations with their providers. Something else I just wanted to bring up is, I guess, views towards medical professionals I think also differ a lot from Western patients and patients from other parts of the world. I've noticed in my personal experience and from other people as well, that often I feel like in the West a lot of patients are sort of a little bit perhaps more entitled to their medical care and more active in their care, whereas a lot of patients from other parts of the world, like Asia or other areas, are more sort of reverent towards their healthcare providers and really look to them as someone that's way above them, and look to them for guidance and for instructions on sort of what to do. And so it's a very different culture. They often are also more afraid to ask questions of their providers, because back in certain countries that might be seen as something that's very rude or offensive to ask your doctors questions, and so they might even coming to America, they might be really hesitant to ask questions or to have open conversations with their healthcare providers. So anything that we can do to sort of break down those barriers, I think, would be really useful and appreciated. And then I guess other things that are sort of culture dependent. Sometimes a lot of people from other countries don't have the same kind of expectations of time, and they might not come to appointments on time or have the same understandings that we do or have, I guess, place the same value as we do on necessarily being on time, so that might be an issue that comes up. And then there's also certain issues that are just more difficult for other cultures to talk about, and so certainly in a lot of countries, mental health issues like depression or PTSD or really any mental health issues are just a big taboo topic that people never want to talk about, and so even if a patient is suffering from it, they're less likely to bring it up with their family and even their medical providers, and so it's important to sort of be a little bit cautious when the way that you approach those topics. And then often with terminal illness, a lot of cultures will will struggle a little bit with talking openly about terminal illness, and a lot of families you might find will tell you not to tell the patient about the fact that they have a terminal illness. They'd rather keep the patient kind of oblivious to that fact and feel that it might be better for their mental state to not know. So again, I think what I'm trying to emphasize is just that we should keep an open mind and not assume that all of our patients have the same needs or values. So another issue that is certainly relevant, especially in hospitals, is dietary considerations. So Islam actually has a lot of teachings about what foods people should or shouldn't eat. In general, the terms used are halal as the term for permissible foods, and haram means it's impermissible. The main foods that are prohibited in Islam are anything that's pork or derivatives of pork, and anything that contains alcohol. And so they certainly don't drink alcohol, but even many people might not realize that a lot of just processed foods will have alcohol as a minor ingredient in them, and also will have pork derivatives in their ingredients, and so even those are things that a lot of Muslims pay close attention to and won't be willing to eat if it has any kind of derivative of pork or alcohol in the food. And then also Muslims often will like to eat only meat that's slaughtered in a particular way according to Islamic rites. I like to explain that it's sort of like the same idea as kosher meat, which I think a lot more people are familiar with, but Islam also has a particular way of slaughtering their meat, and so a lot of Muslims will only, even if it's not pork, they won't eat the chicken or the beef unless it's slaughtered in that particular manner in the halal way. And so fortunately in Seattle, there's a lot of restaurants and grocery stores that provide this meat, but I don't think that most of the hospitals provide it. And so with our patients in the hospitals, they might ask to bring in food from home, or if they have to stick to hospital food, they probably will just prefer to avoid all meat in general and maybe go with seafood options, which are completely permissible, or just vegetarian options. Again, just going back to some of like the different cultural differences between like Western and Eastern values that might relate to some of the Muslim patients or refugee patients in this area. I think I sort of touched on these a little bit, but sometimes the Western values are have more emphasis on individualism and being more independent, whereas Eastern values are more about being collectivist and more dependence on family and friends around you. Also, I think a lot of American or Western people have this sort of notion that they are the master of their own fate, and they have the ability, especially like in the context of diseases, they have the ability to like fight a disease off themselves with their own kind of willpower. But in Islam in particular, you're sort of taught, as I mentioned earlier, that everything that happens to you is like a test from God, and you're not going to be able to overcome it unless God wills that you overcome it. And so it's a very different approach to sort of the things that happen to you. And so a lot of Muslims believe that they're kind of at the mercy of their fate that's determined by God, and there's nothing that they can do except maybe like pray and try to pray and do good deeds, but they can't necessarily like be the master of their own fate the way that a lot of Western people might think. Yeah, I think those are the main points we wanted to say from this slide. Okay, and then I think this is the last topic, just a really brief discussion about how a lot of Muslim patients might approach death and the end of life. It's usually sort of a time, if people realize that they're at the end of their life, it's kind of a time when a lot of people will become more spiritual and want to do things that will bring them closer to God. So a lot of the times, even when loved ones will visit their friends or family that are sick, they'll want to remind them of God and of verses from their holy scripture to bring them comfort and remembrance. And they'll often encourage the patient themselves to also recite verses from the Quran or different verses to remind themselves of God and of the fragility of life and of the afterlife. Which is also something that's an important belief to Muslims, is that there is an afterlife. So in general, I guess, values about death and dying, Islam teaches against, I guess, prolonging life when it's thought that there won't be much benefit to prolonging that life, and so it's sort of discouraged to keep a person on like mechanical ventilation or other things that would prolong their life unnecessarily without necessarily improving the outcome. But at the same time, things like suicide and even euthanasia are pretty strictly discouraged in Islam, and so those are things that are kind of like big taboo issues, things that Muslims are typically taught not to partake in. So it's a little bit of a balance there. And then as far as like autopsies go, usually Islam also teaches that people should try to kind of respect their body as much as possible, and so oftentimes people will be more reluctant to send their loved one for an autopsy just because it involves a lot of cutting up of the body and changing it from its natural form. And so without a really strong indication, a lot of patients would prefer not to undergo the autopsy and just leave their body in the natural form. And then another thing that I think often really differs from Western culture is that Islam really places a pretty big emphasis on when a person dies that they should be kind of buried as quickly as possible and returned to the earth. So that's something that if you ever care for patients in the hospital when they pass away, that's something that might come up, is that the families will really sort of want to take the body away for burial as quickly as possible. They really don't like to do things like embalming the patient or keeping the patient outside of before burial too long. They'll try to do it as quickly as possible, often within a day. And then also traditionally Islam actually doesn't use, they're taught not to use coffins during the burial process. So what happens usually is when a person dies, their body will be washed by a family member usually, and then they'll be wrapped in just a simple white cloth and then buried in the ground. There's actually some Muslim burial sites in the greater Seattle area, and I'm not exactly sure how they do it there. It sort of sometimes depends on the laws of the state. But traditionally that's what the teaching is that you don't even use a coffin at all. And I know that actually there's some kind of like green burial movements even in America that I've heard of, where people are trying to move away from using the big wooden coffins that are traditionally used, and are trying to go with like really simple coffins that are very easily compostable and degrade much more faster and quickly. So that certainly is something that's kind of in line with Islamic teachings as well. And then, as I mentioned earlier, Islam teaches that there is a life after death, and so that's something that's really important to Muslims as well, and something that they might talk about and think about a lot when they're at the end of their life. Alright, so just some kind of final thoughts. Again, I tried to teach or talk about sort of like the most traditional teachings of Islam and how they might relate to treating your Muslim patients, but I think it's important to realize that there will be a wide spectrum of Muslims, and their beliefs and practices to these teachings will vary immensely, and so I think it's most important to just be aware of these things, but also be open-minded and not try to assume that you know what a certain person believes or what their values are, and just allow them to teach you instead. I think that's the most important thing, is just to be able to ask and let your patient teach you what their particular needs are. But with this background, I hope that you have a little bit more context to be able to provide them with the care that they need. And I know we have a few minutes, so I'm happy to take any questions. Yeah.
Okay. With burying the body, like instantly, sort of thing, does that mean they're against like any type of organ donation and donating the body to science? How does that work?
That's a good question. No, that doesn't mean that. Certainly, like Islam teaches that you should try to help people with your body as much as possible, and so organ donation is not prohibited. There's maybe a little bit of difference of opinion, but I think many scholars would tell you that organ donation is perfectly allowed for the sake of helping other human beings. But I guess like a lot of people will not feel comfortable doing an autopsy just for like without a really strong need for it. Yeah.
So we do a lot of head and neck exams. When we have a patient who's the opposite sex, are there things that we should consider while we're feeling around like the neck and head?
Oh, that's a really good question. I actually didn't mention this, but I meant to, is that, so I said that people will often provide or prefer like same-gender providers, but also in the context of medical care, the usual like teachings about separation of genders and modesty are sort of made a little bit more liberal for the sake of medicine and for proper treatment. And so I think you shouldn't hesitate too much. Like if it's important for you to feel a certain part of their head or neck, then the patients will also understand the importance of that and will be kind of open to you doing what's necessary. Yeah.
Are there any prohibitions against touching feet or showing soles on your feet? I thought I read somewhere that was supposed to be acceptable.
Oh, I don't think so, no. A lot of women will cover their feet, usually in public, but again, like for the purposes of medical diagnosis and care, then that's perfectly acceptable, yeah.
Also, when the family does the bathing, would that ever be done in the hospital, or would that always be done after they were taken from the hospital?
Oh, it's usually done. Oh, yes. Sorry. Yeah, she's asking. So the first question was asking if there's any prohibition about touching feet, and I said no. A lot of people will cover their feet out of modesty, but there's no prohibition to touching them if necessary. And the second question was about washing the body after a person dies. It has to be in the hospital, and no, a lot of families will take their their loved one home and do it in their home setting. Yeah.
I was just wondering if we should provide them.
Oh,
They
yeah.
need to wash the patient.
Yeah.
It's actually a really good question about the feet, because where we actually have seen most of our Muslim
Yeah.
People that we serve is in the refugees who are in the shelters, women shelters.
Oh, yeah.
And so we've seen an increase over the past 5 years, more
Mm-hmm.
not so much from domestic violence as it is of political reasons of being refugees
Mm.
or getting settled, but they don't have a home when they first come.